The reopening of a spillover mortuary in Surrey was a stark reminder of the high toll of this pandemic. And today, as if it were needed, there was further evidence. The Office for National Statistics released figures which show that almost half of the registered deaths in England and Wales in the final week of 2020 involve coronavirus. And of the nearly 5,000 deaths registered in hospitals, nearly half involved COVID-19.
This pandemic is the biggest health emergency this country has faced since the Second World War. For the last few weeks, through the Christmas period and right through the start of the new year, we have been facing three substantial challenges. At the start of November, NHS hospitals in London were caring for 1,000 patients with COVID-19. On Christmas Day, that had increased fourfold to 4,000. And today, that number has nearly doubled to just under 8,000. And more than 1,000 of those are on critical care, the sickest patients.
His warnings echoed by NHS providers in evidence to the Commons Select Committee this morning.
We were hoping for a sharper peak that came sooner and shorter. So something, for example, where we saw the peak and started to crest it in mid to late January. It now looks like the peak for NHS demand may actually now be in February. Now, if that's right, that's going to basically mean there's a higher level and a more extended period of pressure on the NHS than we were expecting even just a week ago.
At St Helier Hospital in Carshalton, Surrey, yesterday we saw firsthand more patients needing intensive care than there were beds. More stark statistics. 20% of the people served by this hospital are from Black, Asian or minority ethnic communities. They make up 20% of admissions for COVID, but they are 40% of the patients on intensive care.
Yeah, let's do it so we know it's like still.
As all England's trusts are required to, they have risk assessed their BAME staff to ensure they are safe.
As BAME staff, we are affected more, disproportionately to the rest of the population, and that's hard. It's hard for me as a BAME chief nurse. It's hard for the BAME staff that I need to try and support. We have had a number of staff, for instance, who we've had to remove from frontline. Not because they're unwell, but because they, being BAME and the other issues that have come up as part of their risk assessment, we know that they can't work frontline.
And yet, even with those risk assessments, there is, as we learned, still a nervousness.
I am really worried about my safety, especially this time around. I'm seeing lots of people my age group and also from the BAME community. That's why I'm taking my vaccine. I'm taking my vaccines Friday, and I'm going to take the second lot. I think this is the only thing that can help us, really.
All this on wards, which she described to us as sometimes like a war zone.
Sometimes you go home, you're so overwhelmed, your adrenaline is built up in your system. It takes you hours to get settled.
Are you okay?
Yes, I'm okay. We're trying to support each other.
Now, ministers in Northern Ireland say they are now living through their worst-case scenario predicted at the very start of the pandemic. Our correspondent Paul McNamara is in Belfast. Paul.
Yes, John, Northern Irish hospitals have just experienced the most intense weekend of the pandemic to date, and hospitalisations are on the increase. But Northern Ireland is already 3 weeks into a strict 6-week lockdown. So politicians in the executive don't actually have that much left in the locker. And today the talk from First Minister Arlene Foster has been of possible reintroduction of a curfew and a possible lockdown extension. Now, counterintuitively, after giving you all that bad news, the infection rate has actually decreased significantly. That all-important R number. 10 days ago, it was 1.8. Now it's between 1.1 and 1.2. But of course, there's a delay between infection and hospitalisation. So the picture being painted by the politicians and health officials for the next couple of weeks is a very, very bleak one. Michelle O'Neill, Deputy First Minister, said Northern Ireland is currently experiencing its pandemic worst case scenario. The chief executives of the 6 health trusts has said as bad as things are right now, coronavirus inpatient numbers could double by next week.
Paul McNamara in Northern Ireland. Now, the lockdown rules are clear and they will be enforced. That was the message from the Home Secretary at this evening's press conference. Priti Patel said a minority of the public were, quotes, putting the health of the nation at risk, warning that there would be tougher police approaches to anyone flouting the rules. Our political correspondent Liz Bates is in Westminster. Liz.
Yes, so another big push from the government today to get that message through to the public that they must follow the COVID rules, and that if they don't, the police will be tougher in enforcing them and that they will be quicker to issue fines. But at the same time, there's still some confusion as to what those rules actually are. And in particular, this idea that you must stay local to do exercise. And that hasn't been helped in recent days by the Prime Minister, Boris Johnson, being spotted on a bike ride 7 miles from his home in Downing Street. A spokesman has insisted, though, today that that was within the rules, although they did add that they are somewhat open to interpretation and that people must use their own judgment when deciding how far to travel from their home. But that has prompted today the head of the Metropolitan Police, Cressida Dick, to say that on this issue there must be more clarity. The Home Secretary, though, Priti Patel, has said that the rules are clear, and she said that repeatedly when she was speaking at the Downing Street press conference this evening.
The rules are tough enough. You've already heard 45,000 fixed penalty notices that have been issued, just in the recent time since we've been in this pandemic. So they are tough enough. The message is clear. We urge everybody to continue to follow the rules. The more we follow the rules, the sooner we can drive this awful, atrocious disease down.
Yes, and it's not just the government. The supermarkets have also said that they will now be stricter in enforcing their COVID rules. Some of the big supermarkets today saying that they will now deny entry to customers who aren't wearing face masks unless they have a medical exemption, and that they will also be stricter when it comes to enforcing social distancing rules within their stores.
Liz Bates. Well, now, how soon can we expect the mass vaccinations to begin driving down the numbers of people dying with the virus? As of the 12th of January, more than 2.4 million people were vaccinated. If this current rate of vaccination continues, then the 13.9 million most vulnerable people that Boris Johnson has committed to vaccinating will all receive their first dose by the 16th of March 2021. Modelling conducted for this programme by Professor Carl Friston of the University College London suggests that if an average of 58,000 vaccinations a day can be delivered, 12.1 million older people can be vaccinated by the 1st of March. The modelling suggests that those vaccines could be a factor in reducing deaths this winter. By the 31st of January, daily deaths would be at 296. By the 15th of February, they would be at 137. By the 1st of March, through a combination of vaccination and restrictions, they would be down to 92 per day. Well, I'm joined now by Professor David Spiegelhalter, Professor of Risk and Evidence Communication at Cambridge University. Professor Spiegelhalter, thank you very much for joining us. Politicians and medics alike are talking of numbers rising all the time. Today is an example, and worsening next month. Does that tally with your own research?
Actually, the one thing that does look as if cases might very well be levelling off. But of course, they have longer term consequences. It would mean, if that were the case, that hospitalizations would start leveling off maybe in about a week, 10 days, but deaths are going to keep on going up for about another 3 weeks, I think, in spite of the figures you've just shown. I think it's very plausible. Deaths at the moment are running perhaps about more than 800 a day. The 1,200 reported today was taking up some of the reporting delays from the weekend. But I think just from the people currently infected, we could expect deaths to rise to more than 1,000 a day before the end of the month. It's a very tough time. But as you said, with millions of people now having the first dose of the vaccine and it rolling out, really quite dramatically, we should see that start having a noticeable effect in February and a steady improvement in hospitalizations and deaths throughout February and March.
But overall, is the vaccination programme the panacea that everybody's looking forward to? I mean, is it realistic to think that you can have such a dramatic impact?
Yes, it is. I think, one of the things that we've known throughout this virus is the enormous gradient in risk, with older people having 1,000 times the risk of younger people. And the strategy of prioritization is focus on these higher risk groups and vaccinate them as quickly as possible, specifically targeting hospitalizations and deaths. And as more and more of these older groups and people with medical conditions are vaccinated, then 90% or 70 to 90% of them will be prevented from getting the virus, getting the disease, and therefore being hospitalized and deaths. No, it is going to have a dramatic effect. It is quite extraordinary what we're going to see, I think. But until that happens, the NHS is going to have a massively tough time over the next few weeks.
Now, the Office for National Statistics has today said there have been more deaths from COVID than civilians killed on the ground in Britain in the whole of the Second World War. In what way is that a useful statistic, if at all? Is it merely going to enable us to place this in history?
I think it is sort of helpful. I mean, also the total number died this year, registered this year, is about 600,000. That's 75,000 more than over the last few years. And that's the sort of jump there was in 1940, or slightly less than that, in civilian deaths alone. And so I don't think we can make a direct comparison, except to say that this is comparable to that cataclysmic event. More, as you said, more people have died from COVID, and that means died caused by COVID, not just dying with COVID on their death certificate, than civilians were killed in the Second World War. And it does provide a powerful image for just the, just the casualties that have happened this year.
And very briefly, what does history tell us about how quickly we could recover from this? I mean, do we compare recovering from the Second World War?
Oh, I think history has got some interesting lessons. Many people are talking about, what, after COVID, what do we expect? How are we going to rebuild the world? Remember, in the Second World War, the planning for the welfare state, Beveridge Report was all going on at the darkest time of the Second World War in 1942 and 1943. And I think it is very appropriate that at this absolute dark time, possibly the darkest in the whole of the pandemic, that we are thinking that we've got some of that Beveridge spirit, and we are thinking about how in the future we are going to try to make sure that it's not the most deprived members of the community who suffer the most in the future.
Professor David Spiegelhalter, thank you very much indeed for talking with us.